Imagine watching your parents, the people who raised you, take a shot that could actually do more harm than good. You love them, you want the best for them, but what if the very vaccines they're being told to take after 60 could weaken them instead of protect them? Stay with me, because what I'm about to reveal could change the way you think about these vaccines forever. Hello, I'm Dr. Emily. I've been practicing medicine for over 25 years, helping thousands of families make informed decisions about their health. Over these years, I've seen what works and what can backfire, especially when it comes to vaccinations in older adults. Today, I'm speaking as both a physician and a daughter. I will never let my own parents receive certain vaccines after 60, and I want to explain why. Vaccines save lives, no doubt about it. But as we age, our bodies change, the immune system weakens, metabolism slows, and the way our body responds to medications or vaccines isn't the same as it was in our 20s or 30s. That's why what's recommended for younger adults isn't always safe or necessary for someone over 60. Let's start with the flu shot. Millions of Americans over 60 get this vaccine every year, thinking it's harmless. The standard flu vaccine contains inactivated virus, which is generally safe, yes, but for older adults with autoimmune conditions, chronic inflammation, or certain heart problems, repeated annual flu shots can sometimes trigger immune stress. I've seen cases where inflammation and mild autoimmune flare-ups were linked to the flu vaccine. If your parents are healthy, an annual flu shot may be fine, but for those with underlying conditions, a personalized approach is better. This could mean high-dose or adjuvanted vaccines, spacing the shots differently, or evaluating each situation carefully. Individualized care is always better than a blanket rule. Next is the pneumococcal vaccine. Everyone over 65 is often told to get it, sometimes even after 60 if they have risk factors. Pneumococcal vaccines prevent serious infections like pneumonia, but the new conjugate vaccines are very potent and can cause high levels of systemic inflammation in some older adults. For someone with heart disease or kidney problems, that inflammation isn't harmless. Short-term fevers, fatigue, or even more serious complications can occur. It doesn't mean the vaccine is bad. It means timing and supervision are critical. Giving it blindly without considering personal health history can sometimes do more harm than good. Now, shingles. Shingrix is widely promoted, and for good reason. It's very effective, but it's also extremely strong. This vaccine is known to cause intense reactions, fever, fatigue, severe injection site pain, sometimes lasting several days. For older adults with chronic fatigue, diabetes, or heart conditions, these reactions can be serious. As a daughter, I would carefully weigh the benefits versus the risks. Delaying, spacing, or evaluating if it's truly necessary can make a huge difference. COVID boosters are another hot topic. Millions of Americans over 60 are encouraged to take multiple boosters every year, but the immune response in older adults diminishes over time, and repeated boosting with the same formula can overstimulate the immune system. Rare but real cases of myocarditis, arrhythmia, or inflammatory reactions have been seen in older patients after repeated doses. Not saying avoid it completely, but knowing who really needs it is crucial. Spacing doses or choosing the newer formulation can prevent complications. It's about smart medicine, not fear. Finally, vaccines like hepatitis B or routine boosters for tetanus and diphtheria. Most younger adults benefit without issue, but after 60, especially if someone has liver or kidney conditions, these vaccines can produce exaggerated immune responses. There's also the question of necessity. Does your parent have risk factors for hepatitis B? If not, why risk unnecessary side effects? Following blanket recommendations without considering personal health history can be dangerous. Each vaccine needs to be evaluated individually. Not every shot is essential for every older adult. As a physician and a daughter, I've learned that caring for older adults requires more than following guidelines. It's about understanding each person's health, their vulnerabilities, and making informed choices to protect them. That's why I will never let my parents take certain vaccines blindly after 60. It's about love, care, and informed decisions. As we get older, our bodies simply don't respond to vaccines the way they did when we were younger. I've spent 25 years studying this, treating patients, and reviewing countless medical records. One thing is clear: the immune system of someone over 60 is not only weaker, it's also more sensitive to overstimulation. That's why the same vaccine dose can have very different effects in older adults compared to younger adults. Let me share a real example. I had a patient, a 67-year-old woman, who was perfectly healthy but decided to get both her annual flu shot and the shingles vaccine within the same week. Within 24 hours, she developed high fever, severe fatigue, and joint pain. She had to be hospitalized for monitoring. Her immune system basically went into overdrive. Now, if she had spaced these vaccines by a few weeks, this could have been avoided entirely. This is not uncommon. Many families don't realize that timing and spacing are crucial for older adults. Another case was a 72-year-old man with mild kidney disease. He received a pneumococcal shot without prior consultation. Within a few hours, he experienced dizziness, fatigue, and a spike in blood pressure. We treated him promptly, but it was completely preventable. His reaction wasn't because the vaccine was inherently dangerous, it was because his body couldn't handle the inflammatory response at that time. This is why I always emphasize personalized care for adults over 60. Let's talk about the science behind it. Vaccines work by stimulating the immune system to recognize and fight pathogens. In younger adults, the immune system is strong and responds efficiently, but in older adults, immune cells are slower, less flexible, and sometimes overreact. When a potent vaccine is introduced, it can trigger excessive inflammation, sometimes causing fevers, fatigue, joint pain, or even more serious complications like heart rhythm disturbances. This isn't fear-mongering, it's what decades of research and my own experience show. Take COVID boosters, for instance. Repeated exposure to the same antigen in older adults can lead to hyperactivation of the immune system. In simple terms, the body reacts too strongly, and that's when complications occur. This is why not every booster is automatically necessary. I always review a patient's medical history, prior vaccine reactions, and current health before recommending any booster after 60. It's about making decisions based on risk versus benefit, not just following a schedule. Even routine vaccines like hepatitis B or tetanus can have amplified effects in older adults. A 65-year-old woman with mild diabetes received a tetanus booster and developed a 3-day fever and severe arm soreness. For her, the vaccine wasn't harmful long-term, but it caused unnecessary stress and discomfort. Situations like these reinforce why we can't treat older adults like younger ones when it comes to vaccinations. So, what can you do as a family member? First, don't follow blanket recommendations blindly. Second, talk to your doctor about each vaccine individually. Ask about timing, spacing, and potential risks. Third, keep track of your parents' past reactions. Even mild fevers or fatigue can provide clues about how their immune system responds. As a daughter, I take this responsibility very seriously. When my parents approach 60, I review every vaccine with their doctor. Some vaccines are essential, like the flu shot for high-risk patients or Shingrix for those susceptible to shingles, but others may be delayed or modified based on their health. This personalized approach isn't common knowledge, but it can make the difference between a healthy, safe experience and unnecessary complications. One more example. I had a 70-year-old patient who wanted all recommended boosters at once. I explained that spacing them out over a few months would minimize inflammatory reactions and provide better immune protection. We started with the vaccine that posed the highest risk if delayed and spaced the others. Not only did she avoid severe side effects, but her immune response was actually stronger than if she had received everything at once. This is the kind of strategy that every adult over 60 should consider. It's also important to consider lifestyle factors. Nutrition, sleep, stress levels, and underlying chronic conditions all affect how a body responds to vaccines. I've seen patients who are well nourished and physically active tolerate vaccines with minimal reactions, while those with poor diet or uncontrolled conditions experience stronger side effects. Vaccines don't exist in a vacuum, they interact with the entire system. Lastly, always remember that being proactive matters more than being reactive. Scheduling vaccines with careful planning, consulting with your doctor, and monitoring your parents afterward is how you protect them effectively. It's not about skipping vaccines, it's about smart, informed choices. Caring for older adults is about understanding their unique needs, not just following generalized schedules. Every vaccine decision after 60 should consider their health, prior reactions, and personal risk factors. That's why, as a physician and as a daughter, I will never let my parents take certain vaccines blindly. The goal is to protect them, not just follow a checklist. Now that we've talked about the vaccines that need careful consideration and the science behind them, let's focus on what you can actually do to keep your parents safe and healthy after 60. Because at the end of the day, knowledge without action doesn't protect anyone. First, always start with a detailed health review. Sit down with your parents' doctor and go over every chronic condition, past reactions to vaccines, medications, and lifestyle factors. Ask questions like, is this vaccine truly necessary for them right now? Could spacing it out reduce side effects? Are there alternative formulations that might be gentler on their immune system? These are the conversations that make a huge difference. Second, timing is everything. Older adults don't need to get multiple vaccines all in one day or even in 1 week. Spacing them out over a few weeks allows the body to handle the immune response without being overwhelmed. For example, if your parent needs a shingles vaccine and a flu shot, giving them 2 weeks apart can minimize inflammation and fatigue. It's a simple adjustment, but it can prevent unnecessary hospital visits and discomfort. Third, monitor your parents closely after vaccination. Keep an eye on their temperature, energy levels, appetite, and any unusual symptoms. Mild fatigue or soreness is expected, but anything more serious, like high fever, shortness of breath, or heart palpitations, should be addressed immediately. Having this awareness allows you to act quickly and prevent complications before they become severe. Fourth, don't overlook lifestyle. Nutrition, hydration, sleep, and stress management all affect how the body handles vaccines. A parent who is well rested, eating a balanced diet, and staying active is far more likely to have a safe and effective immune response than someone who isn't. Encourage gentle walks, healthy meals, and plenty of fluids around the time of vaccination. These small steps amplify the benefits and reduce the risks. Fifth, understand that every parent is unique. Age is just one factor. Their medical history, genetics, and overall wellness play a bigger role than the blanket age recommendation. For instance, a 65-year-old who runs marathons and eats a clean diet may tolerate vaccines very differently than someone the same age with diabetes, heart disease, or kidney issues. That's why personalized care is not optional, it's essential. Sixth, ask your doctor about alternative options. Some vaccines have high-dose or adjuvanted versions for older adults designed to boost immunity safely. Others can be delayed without significant risk, especially if your parent has already built immunity in the past. These options aren't widely advertised, but as a physician, I've seen them prevent complications while still providing protection. Seventh, educate yourself. Many families blindly follow government guidelines or media headlines without understanding the nuances. Being informed doesn't mean being fearful. It means making choices that protect your loved ones. Read reputable medical sources, ask your doctor questions, and advocate for your parents' safety. Knowledge is power, and in this case, it can literally save lives. Finally, remember the emotional aspect. As children, we want to protect our parents at all costs. That love is what drives these decisions, but acting out of panic or blindly following recommendations can backfire. By combining love with informed, practical steps, you can ensure your parents receive the protection they need without unnecessary risk. I've walked this path with my own parents. I've carefully reviewed every vaccine, spaced doses thoughtfully, monitored their reactions, and made adjustments when necessary. They are healthier, more comfortable, and protected because of this careful approach, and that's exactly what I encourage every family to do. Don't settle for routine. Don't accept one-size-fits-all recommendations. Make decisions that truly fit your parents' needs. To summarize, protecting your parents after 60 isn't just about giving them every recommended vaccine. It's about understanding their health, consulting with experts, spacing doses, monitoring reactions, and supporting them with a healthy lifestyle. When we approach it this way, vaccines truly become tools for protection, not sources of unnecessary stress or risk. The most important takeaway is this: your parents' health deserves personal attention. Every shot, every decision, every consultation matters. Love and care guide our choices, but knowledge ensures that our care is safe, effective, and tailored to their unique needs. That is how we honor the people who gave us everything, the people who raised us, loved us, and sacrificed for us. I hope this has given you clarity, insight, and a roadmap to make safe, informed decisions about vaccines after 60. Protecting your parents isn't about fear, it's about responsibility, love, and taking control of their health in a thoughtful, personalized way. As a doctor and a daughter, I've shared these insights because your parents' health deserves more than blind adherence to schedules. Every vaccine, every decision, and every conversation with their doctor matters. Protecting them isn't about fear, it's about knowledge, care, and making informed choices that truly fit their needs. Remember, your loved one's health isn't defined by their age. It's defined by the choices you make for them every day. Start today. Ask the right questions. Advocate for their care. Give them the protection, safety, and peace of mind they deserve. And if you found this guidance helpful, make sure to subscribe to this channel. I share evidence-based, senior-focused strategies designed to keep your parents safe, support their immune system, and help them stay healthy and independent as they age. Start today, stay consistent, and give them the care and protection they truly deserve.